Breastfeeding Week, and right here at Morning Ride, we'll leave no stone unturned. Our children, our newly borns, would really have the luxury, not just the luxury, the necessity of a mother's milk, of breastfeeding. And we're going to do that totally right here on Morning Ride this morning. Now, talking about that, we have two wonderful doctors sitting right here in the studio. We have with us right here Dr. Omo Uwadia. She's Senior Registrar, Department of Pediatrics, Federal Medical Center, right here in Asaba.
Good morning, everyone. It's
good
to
morning.
Be here with you.
Good to be having you here. And also we have with us Dr. Uzoma Joseph Ujawe. She's the Senior Registrar, Department of Pediatrics, Federal Medical Center, Asaba.
Good morning.
Good morning. Welcome to Morning Ride.
Welcome. All right, we're talking about breastfeeding and closing the gap, or supportful role rather. And we don't want to really leave any stone unturned, like I just said earlier on. Now, the first question I just want to go with is the necessity of breastfeeding as regards the newly born.
Okay, thank you. Let me just start by saying, again, this is the World Breastfeeding Week, and we do it every year, every 1st to 7th of August in every year. And it has become necessary because we found out that formula feed, which is baby food, popularly called baby food, was gradually replacing the God-given golden liquids, which is the breast milk. Okay. So the WHO, the UNICEF, and ministries all over the world found it necessary to make a week dedicated solely to promoting breast milk. Now that brings us back to the question he asked. Why is this so important? You see, breast milk is the only complete nutrition known to man. It is complete. It contains carbohydrates, proteins, fat. It contains life organisms that protect the baby. This is what you can, at least you know you cannot get life organisms from baby food. They can put carbohydrate, proteins, fat, but they can't put life organisms. It contains life organisms. These are called immunoglobulins that protect the baby from harm. So its necessity cannot be overemphasized in that everything it needs in its correct proportion. You get. Now, formula feeds, that's baby food, may try to actually what they do is, if you see someone marketing formula, they'll tell you it is as close to breastfeeding. So it means they are only trying to achieve what breastfeeding already has. Okay. That is which means that breastfeeding is still the gold standard. It's still the aim. It's still the highest. Right. Now, breast milk is so important because for the child to get well nourished, adequately fed in the first 1 to 6 months, all they need is breastfeeding. No milk, no water, nothing else.
Okay, I want you to talk on the short-term and long-term benefits of breastfeeding for the mother and the child. What is is there any difference between a child that was breastfed from birth till like 6 months, 3 months, and the child that was not breastfed? Because I've seen babies that maybe something happened to the mother died or something, and the baby was just giving baby food, like you called it, for the first 6 months. So is there really any difference? What are the long-term and short-term benefits of breastfeeding for the mother and the baby?
Beautiful question. Okay, I'll just say some, then she will also. Now, for short-term benefits, yes. I've talked about nutrition. A child that is breastfed can never be malnourished. We've not seen it. The only issue is maybe the mother is unable to establish lactation well. As far as that child is well breastfed, is breastfed on demand, latches well to the breast, the mother can never be malnourished. The child can never be malnourished. Sorry. Unlike when you're getting baby food, the baby food doesn't come cheap. For you to feed a child well with baby food, because we tell our women, if you want to do baby food, are you sure you can? You need 3 things in a week. Yes, and that is a lot. In a month, you bought 3 times 4. That is what? 12 things. That's a carton. So you must have that money, and you would think, and as the child grows up, that's within the first 1 month. As the child gets bigger, the child eats more. So it's very economically taxing. So breastfeeding is the most affordable, most nutritious food for the baby. So that is a beautiful short-term benefit. The child cannot be malnourished. And malnutrition is a problem we have now. Now, even in the short term, the child is protected against a whole number of illnesses. They are protected from all these problems that occur within the first few months of life. We have diarrhea diseases, which occurs from when you are making baby food. Some people may not wash their hands well, some may not clean their utensils well. Then they end up having what we call fecal-oral transmission of pathogens that will cause diarrhea. But in breast milk is completely well prepared, well packaged, directly from the mother to the baby. There's no contamination anywhere. You get. Now we also have prevention from cough, catarrh. You see all these small illnesses that occur to children. The breast milk is laden, like I said, with a lot of protective immunoglobulins. I'm saying immunoglobulins. These are protective substances in our body that protect us against harmful things out there. Right. So these things are already in the breast, and they protect the child in that first 6 months from all these kind of problems. Okay. Now, for the long-term benefits, let me hand over.
Yes, and they also tell us the benefits for the mother, because she has spoken about the baby.
Okay. Thank you very much. For the short-term benefits for the mother enjoys, mother and the child, and there's emotional bonding between the mother and the child. And it helps in cognitive development for the child and emotional intelligence development for that baby. In the long term. That's in the long term. But that's when it starts being developed. It's important for production of oxytocin from the brain. That helps in the contraction of the uterus. That when the woman just delivers, the womb needs to contract so that she doesn't bleed. So as the baby is breastfeeding, the body releases that hormone that helps the uterus to contract. So it helps the mother now to contract the uterus. It helps to continue, establish and maintain, sustain lactation for the mother. And there's this joy and emotional, that the mother has when is breastfeeding her child and seeing the child feeding well. Then on the long term for the baby, it helps in prevention of obesity, which is a very, very beautiful way and a known fact to prevent obesity in children, because everything is packaged in adequate proportion, unlike what we see in formula feeds. And in a bid to get the child to eat and tolerate formula, we tend to give them calories they don't need. We give them a lot of calories they don't require. So they are at risk of obesity later on in life. But breastfed children have been proven to have lower risk of obesity. Like I said before, it helps to improve cognitive development in the child, emotional intelligence and all of that for the child. Even long-term diseases like asthma and I've talked about obesity, asthma. It helps in prevention of asthma and all these allergic conditions in a child that is breastfed when you compare to a child that received formula feed.
How about she talked about the mother. What's the advantage of it to the mother, the benefit of breastfeeding on the mother?
Okay. Aside from the emotional bonding and
you also have contraception.
It's beneficial, yes.
Is that 100%?
No, it's not always 100%, but it's a significant way of contraception. It's a significant means of contraception. Women have consistently reported that when they breastfeed their babies for up to a year, they don't see their period till up to a year. Do you get? So it's not, definitely there's nothing that is 100%, but the contraceptive benefit is such that now you have women within 3 months they get pregnant.
Yes.
This hardly happens. I've not said it doesn't happen. It hardly happens in women that are exclusively breastfeeding their babies, because the hormones that are helping with contracting the wombs and expressing breast milk are counteracting the effects of the hormones that are for reproduction. You understand? So it helps in contraception for usually the first year of life and mostly the first 6 months of life. So as long as the woman continues exclusive, not mixed feeding, not breastfeeding and formula, say okay, I give breast milk. Exclusive breastfeeding has been shown to consistently help in contraception.
How about size and the weight of the woman as well?
Okay,
I've heard it makes them big. I've heard it makes them small.
It actually doesn't make one big, but it's just the notion we have. It actually helps in weight reduction. But the notion we have in Africa that, you are breastfeeding, you should eat for 2, you should eat for 3, we now allow ourselves and eat so much. your weight is directly proportional to what you eat. That's the truth. Apart from maybe if you're having hormonal problems or there's already obesity and all those other things. But if for somebody that doesn't have any medical condition or anything that's making the person not to lose weight, is a very important way of weight loss or weight control for the mother.
Okay, let's talk about hygiene, because you mentioned that with baby formula or baby food, the mother may not be too careful, and then the child may have diarrhea. But I think I beg to disagree. You need to maintain good hygiene as a breastfeeding mother, or the child would still be able to get diarrhea or other health issues, because a mother needs to be hygiene. She needs to maintain good hygiene. So let's talk about what a breastfeeding mother should do while breastfeeding. What are some of the hygiene practices that she should keep up with to make sure that she and the baby are safe?
A very beautiful question. Now, for diarrhea diseases, like if a woman sends, maybe I have a friend or a patient or someone sends me a message and says my baby is stooling 3 times a day or 5 times a day, I just ask, are you breastfeeding exclusively? And she says yes, I don't worry. No.
Okay.
Chances are that the baby is just passing frequent stool. Once I ask her, is the stool loose? The stool, diarrhea, part of the definition of diarrhea is that the stool will be loose. Loose meaning, is it watery? Once I ask her, is this stool watery? She will most likely tell me no. I'm just telling you from experience. Like,
so whether the mother is neat or not, it doesn't affect.
I'll get there.
Okay.
Now, from experience, I have never seen a breastfeeding mother, an exclusively breastfeeding mother, whose baby has diarrhea in the first 6 months. At least I've been training as a pediatrician for 6 years now, more than 6 years. So at least I've had some years in pediatrics alone, not in medicine in general. Okay. So I have never seen. The reason is that now the woman definitely has to keep neat. The woman definitely has to bathe herself.
Okay.
A standard of hygiene should be maintained. Otherwise, the child will have skin diseases. The child will have other problems. May have hair rash. May have all sorts of things. But you see diarrhea, the baby will not have diarrhea. Now, the only way the baby can have diarrhea while exclusively being breastfed is if the mother is expressing. While she's expressing, some women have to go to work. We have to go to work, and you leave the breast milk with someone. Now that person may not be neat. She herself may not be handling her utensils well. We advocate that. We have standard of care. We have a lot of babies, preterm babies, that we know their immunity is very fragile in our wards, and we don't have them coming down with diarrhea on breast milk. Why? We have minimum standards of sanitizing, of sterilizing their utensils. After each feed, you wash and drop in a bucket of water with what we call Milton tablet. This is a sterilizing tablet. If you're not doing that, there's also a place for boiling the utensils for a minimum number of minutes before you use again. With that, you would not have diarrhea. So it's about the handling. It's not about the breastfeeding. Now, the woman's hygiene, even if she doesn't bathe. Now, we don't even tell women before you breastfeed your child, bathe, clean your breast. No.
Why?
Why should you? As far as you've had your bath, daddy, like now, if my baby was breastfeeding now, as far as I've had my bath this morning, anytime I want to breastfeed, I will breastfeed. If my baby came here with me, I will not go and look for wipe to clean my breast.
But women, I know women wear the same innerwear over and over.
Women wear
the same innerwear.
Bras,
I've seen that.
Are you a woman?
I'm very concerned about that too.
Yes, you should.
If you use the same bra you used yesterday and today.
When you were yesterday, you had your bath, right?
Like she said something that is a minimum standard of hygiene. Everybody should maintain.
Okay.
You don't expect a woman that is breastfeeding or as a breastfeeding mother
to be
and you have milk pouring out. You will still use the bra the next day. It will smell. Breast milk smells.
You don't put a breast pad.
Now,
I must say, okay, finish.
So it's important that you actually maintain the minimum
hygiene,
minimum standard of hygiene.
Yes, but please, another reason why it's not advocated that you wash the breast is that your baby must get used to your normal flora.
Exactly.
What is normal flora? Normal flora is You know, we are not sterile.
Yeah, everyone.
Everybody has organisms on. If you take a swab of my skin and take it to the lab, you culture Staph aureus. You will definitely culture Staph aureus.
What's culture Staph aureus?
Staphylococcus aureus. You culture it. It's on our skin. It's not as
I know that.
as horrible as our Gbogbo Nishe people say. So it's an ubiquitous stuff that is all over us. And you culture some other organisms. These are things on our skin. So the baby must get used to that, my normal flora. Must get used to and get colonized. Colonized means he himself.
When you say flora, do you mean the mother's scent?
No, flora. I just say organism, microorganisms on our body.
The baby get used to it.
Yes.
They have to get
And
it. They have to grow on their own baby's body.
Yes.
The mother has to transfer her
Own
bacteria, good bacteria
on
to
her
the
skin,
child, to the skin of the baby, because it
Is that done
protects.
through breastfeeding or just
No,
putting the
because
baby close to you?
by putting the baby to breast, the baby is sucking your skin. Not so. The
Yes.
breast is covered by skin, and on your skin you have all these organisms.
And on your body, as you
So
are carrying
we
the
don't
baby,
want you to go and clean it off. Otherwise, the day the baby now takes that skin, the baby gets a problem.
Becomes
so the baby
sick.
gets
Adapt.
immunized. Yes,
Exactly.
thank you. They get immunized to these skin organisms over time and grows their own immunity.
This is deeper than I thought.
and you know that breastfeeding is like the first immunization a child
I was going to
gets.
ask that.
It's the first immunization a child gets. So when you introduce this child to the mother's flora, remember that the mother has antibodies in the breast milk. So you're already protecting that child against any other thing. Remember, these children come sterile to us. So if we don't get their bodies colonized with good bacteria, they can pick up the harmful ones around. So that's the benefit of putting the child to breast. Within the first 30 minutes of birth, put the child to the mother's skin, put the baby to breast. So you're introducing this baby to this mother's normal flora, the normal good bacteria on the mother's body that the mother already has antibodies against. So when you now breastfeed this baby, the baby gets immunized, and you have saved that baby from contacting other organisms from the environment.
There's this thing I heard about the first drop of milk from the breast. Is
Yes,
there something,
colostrum.
something powerful about it?
Oh, extremely powerful.
It's actually a very, very, very important part of breastfeeding.
That first drop.
Yes,
Very
it's
golden.
high, it's very good, it's very good. And this brings me to what I heard yesterday. Just yesterday, I heard that somewhere in Delta State, women go to flog their breasts. Oh, I just screamed like this yesterday.
Okay.
Flog.
Yes.
Why?
Somewhere in a car, towards the car, I'm trying to, I met a woman yesterday
Yeah.
that talked about, in fact, someone brought it up in clinic, and one of
Why
our
are they
patients
flogging
agreed
their
to
breast?
it. She said that they try to remove, that there are things that they need to flog the breast and wash it, that women stay in queue to get their breast washed.
Oh my goodness.
For her landlady asked her to go and get her own breast flogged, that is why her baby is not
We'll
suckling.
talk to our newsroom and we'll investigate that story.
Oh,
Really.
okay.
Because it's worth
So
investigation.
colostrum is very important. That's the first milk that comes from the mother. It's
it
called
is
colostrum,
lady-
and it's high calorie. It has a lot of calories. It has a lot of immunoglobulins. And some people say, it's not fine. It's not fresh. Remove
Yes,
that
there are
one.
actually cultures where they express it. They express
Yes.
that yellow. It's very yellow. It's not as
Clear.
as light as the breast milk that comes after some weeks or days. So in some cultures they express it. Even in Nigeria, they express it till they get to the other one.
The so-called fresh one.
Yes.
So
And
the
do you
baby
know
needs
the
everything.
everything. Do you know the irony of that? God is actually very wise. In the first few hours and first day of birth, the mother may not be able to produce so much quantity,
Yes.
but that little quantity is enough for that baby. Because it has a lot of calories. He's laden with enough glucose, enough everything that baby needs for that first 1 or 2 days.
Okay, we've talked about this. How about those mothers that cannot express on the first try? I've seen women that struggle before they could lactate.
Beautiful. That brings us to one of the things we are trying to achieve in our hospital, which is breast milk banking.
breast milk
Breast milk
banking.
banking.
Yes.
Like, okay, I don't want to mention what's in my head, but talk to us. What is breast milk banking?
Breast milk banking is basically having a place where breast donors come, just like you have a blood bank.
Blood bank, okay.
Yes, donors come, express breast milk, and keep.
Well, the
I've
donor
heard of
doesn't
that.
have a
Is it
child.
possible to feed a baby with another mother's breast milk?
Oh, we do it all the time.
Very
in
possible.
our hospital. In short, we advocate for it.
It's very possible.
Yes,
very,
we do
very,
it for-
especially
you should come
for
to FMC.
especially
We do
for
it.
small and sick
Sick
newborns. Actually, in Nigeria currently there is a breast milk bank in Nigeria, one in Solo, Lagos. And women working donate breast milk. It's pasteurized. They are tested. The breast milk is tested. It's quality controlled. It's screened, and then it's bagged. Because situations come where we have very small babies or newborns that
Premature
their mothers
babies.
are not available. Maybe their mothers died and all of that, and they need it. In fact, I remember during the COVID year in 2020, I was a human donor for a baby whose mother died of COVID.
Oh dear.
And today that child is very, very
Doing
fine.
very well.
Very fine. She's doing very well. Her uncle always says, your baby, they ask about your baby and all of that. But what I'm trying to say is that it saved that child. We were able to do that for that baby for about 3 months or thereabout. The baby stayed, because it was a preterm baby, stayed with us for about 3 months. So at least for that first 3 months, he got all the benefits of breastfeeding. And so it's important for especially sick babies and very tiny babies.
Preterm babies. premature babies.
Okay, I want you to talk about some of the myths that people have about breastfeeding. We've heard so many things about breastfeeding. Some will tell you that if you breastfeed, your breast will sag. And some will tell you, oh no, it's not good to breastfeed a child for 6 months. You need to keep fit as a woman. If you breastfeed, it will make you lose your shape. Others feel if you skip breastfeeding for a day, the breast milk will get sour. And so you automatically stop breastfeeding the child because your breast milk is now sour. So talk to us about some of the myths and correct those myths.
Let me start from the breast milk getting sour. Do you really believe? Like, I have blood flowing in my
I believe
veins
that's a
now.
child actually.
All right, I have blood flowing in my veins.
The blood can get sour.
So whenever I want to take blood or I want to donate, they will just take the blood, right? Same thing with the breast milk. The breast cannot get sour because there are it's surrounded by living cells. So it's not like it's outside. I remember I have a senior colleague that told me that she traveled, she had to go for a course for a week and some. And she had a baby, she was exclusively breastfeeding. So she expressed for very long before leaving. And the breast milk, because she started expressing on time, knowing that she was traveling. By the time she came back, she had lost lactation. So her breast was not coming out voluntarily. That she put her baby to breast every day till she reestablished lactation. That is a doctor. What am I saying? I'm saying that for almost 2 weeks, the breast didn't get sour. So the breast can actually not get sour.
All right.
Please.
All right. Just one more of the myths you cleared, and we'll say goodbye. My time is really up. Talk about the weight, the shape, and all that, and the breast getting sagged.
Okay, I would say that breastfeeding actually doesn't make the breast sag. Why would I say that? I think what makes improper positioning and attachment may be the problem. But if mothers are taught proper positioning and attachment, they may not get into that. And the truth is that as we age, the ligaments will, they're also growing old. So they will definitely sag. So it's not because of they will sag.
No, that's clear. That's clear.
Okay.
So before you go, talk to us men, because sometimes we are the support system.
Exactly.
How should
Not sometimes, you are the support system.
I know I said sometimes, because women can, whether you are support or not, they will do what they want to do. But what should we do, men, husbands? How should we love our wives during that period? If you know what I mean. Just before we say goodbye.
Okay, I would say that like this year's theme says support for all. Closing the gap, support for all. A breastfeeding mother needs maximum support because she needs to be emotionally stable, she needs to be psychologically stable. She's going through a lot of emotional and psychological problems at that time. Not problems, but she needs a lot of support. She has to wake up at night, she has to breastfeed this baby maybe 2 hourly, 3 hourly, 1 hourly, and all of that. So the husband's role cannot be overemphasized. You need to support, you need to provide financially, provide emotionally, be available as much as you can, and help the child to really help the woman to really be comfortable enough
And not be greedy.
to go through that
And not be
process.
greedy. I'll say that one lastly before we say goodbye, because
You will explain about the show.
someone will say, stop that, it's my time. Junior has had enough, it's time for daddy. But they should stop all that. Thank you so much. Wonderful women, wonderful doctors. Dr. Omo Uwadia, Senior Registrar, Department of Pediatrics, Federal Medical Center, Asaba. And Dr. Joseph Uzoma Ajawengi, Senior Registrar, Department of Pediatrics, Federal Medical Center, Asaba. Good to have you. Always a privilege.
Thank you. Thank you for having us.
Delta Broadcasting Service for having us this morning.
Thank you. Blessings, say goodbye.
Yes, it's breastfeeding week, and like the doctors have said, let's close the gap, let's support all. Let's support mothers, let's support breastfeeding mothers. Do the best you can as a husband, as a family member, as a community to support a breastfeeding mother. Thank you so much for joining us this morning. I am Blessing Usiabada.
Yes, you heard the lady, all that she said, and be safe out there. Whatever you choose to do today, if you choose to go out or not, be safe. Do not turn that thing into any kind of violent move. Try to just ensure that you stay healthy, you stay safe, and you act right. My name is Francis Ofulue, saying goodbye from Morning Ride, but stay with us right here on Delta Television. We are the People's Pride. Goodbye.